Well, in January, people across the nation were unified in hoping Buffalo Bills safety Damar Hamlin recovered after suffering a cardiac arrest during a game. A quick response saved Hamlin's life, and now he's taking this opportunity to advocate for more CPR training and access to AEDs. Our Washington, D.C. correspondent Rachel Knapp has more.
We are so humbled and inspired by what I feel is an opportunity that God has given me to help and protect young people based on what I experienced.
Damar Hamlin, the Buffalo Bills safety who suffered a cardiac arrest during a Bills game in early January, recently visited the U.S. Capitol, advocating for the Access to AEDs Act. It's a grant program to support CPR and AED training in K-12 schools, buy AEDs for schools, establish cardiac emergency response plans, and promote the importance of defibrillation in schools.
This legislation that will focus on schools is a really important piece of the entire plan to create a nation of lifesavers.
Nancy Brown, the CEO of the American Heart Association, says 350,000 people in the U.S. experience sudden cardiac arrest outside of the hospital each year, and 1 in 300 kids have an undetected heart condition that puts them at risk. Student athletes are more likely to experience cardiac arrest.
Access to CPR and AEDs is the difference between life and death.
Sporting a signed Hamlin jersey, New York Senator Chuck Schumer praised Hamlin and others for advocating for this legislation.
They've dedicated themselves to making sure no child, no family, no community should go through what they did.
Hamlin says when he played football as a kid, he never thought about CPR or where an AED was at his school. He hopes this legislation changes that for others.
The Access to AEDs Act will help ensure that schools are just as prepared and trained to respond in a time of crisis as those on the sideline of an NFL game.
At the Capitol, Rachel Knapp reporting.